Yo, what up, y'all? It's your boy Rob coming back at you once again with another live stream. So before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get it cracking. All right. So what we got today are a couple of monkeypox updates, and we also have some C19 information. All right. And you guys, I think, will be particularly interested in the monkeypox update because it's what everybody's been waiting for. It's what everybody's been waiting for. So today's monkeypox information comes from Philadelphia. All right. So what we're going to do is we're going to check out this article from Action News 6. All right. Shouts out to Volvo 2 Love in the building. Real quick, ladies and gentlemen, don't forget TD and Rob just talking today at 2:30 p.m. Eastern time. If you're not subscribed, make sure you go over there and hit the link. The description is in, I'm sorry, the link is in the description box. We're 2 subscribers away from 1,000. So help us out, smash that like button. All right. Also remember, make sure that you guys always binge watch all of the content on these videos. Bring that information back into the new videos so that we can build on it. Shouts out to Hey Mr. Knickerbocker. What up with it? Also, ladies and gentlemen, if you're not subscribed to my other social media, hit the description box, hit the about page, and hit the backup channels. All right. Shouts out to Carla. What up with it, Carla? So we have a situation in Philadelphia, a painful situation. It still hurts. There's a Philadelphia man with monkeypox, ladies and gentlemen, and he shares his story. At first, he said he wasn't sure what was making him sick. He had swollen lymph nodes, his throat was swollen, and his body was aching. Let's see what's got him feeling so down, shall we?
Now the details. There are more than 6,000 cases of monkeypox in the United States, and that number continues to climb. More than 1 million doses of the vaccine have been allocated to communities throughout the nation. Now tonight, we're hearing from one local man who has the virus. Action News reporter Katie Catro joins us now live from Fairmount Park with his story. Katie.
Sarah, we spoke with that man who says he was trying to figure out why he wasn't feeling well. He says what he thought was a cold sore turned out to be monkeypox.
Went home and was like, okay, I'm in a lot of pain. This is crazy.
Larry Jackson III says he had multiple doctor visits to figure out why he was in pain.
Shout out, Mike.
I'm in the hospital now. I'm trying to figure out what's going on, if it's monkeypox or if it's just a blister or something.
He says after an initial diagnosis of strep throat, he found out he has monkeypox.
It still hurts.
So now, real quick, ladies and gentlemen, clearly we see this individual. So, I mean, we don't need to say anything else about that. But what I find fascinating is that he said he went to the doctor and the doctor initially diagnosed him with strep. Now, that's interesting because you guys remember the video from Jimmy Dore that we watched. There was the young lady on TikTok, and when she went to her doctor, they passed her around to a couple different places. And when they diagnosed her at first, they thought that she had MRSA. So now what I find fascinating is it seems like they're starting to develop a pattern of physicians not going beyond the skin symptoms when diagnosing this disease. When it comes to these patients, they'll initially look at the skin situation and diagnose what it looks like instead of looking further to investigate to see if it's actually monkeypox, which tells me that more than likely there needs to be some type of testing apparatus to improve accuracy. All right. Shouts out to my man U-Law. What up with it, bro? Real quick, ladies and gentlemen, if you guys have not smashed that like button, take a moment. Make sure you guys bang on that like button. Also, I'm going to try to get around to doing some crime casts today. All right. And you guys are not going to want to miss those. So if you guys are not subscribed to Crimecast, take a moment. Make sure you guys go over there and subscribe to that channel. All right. Because I'm going to try to bust out a couple of those today if I can.
Like some of the bumps hurt, itches,
The 29-year-old from North Philadelphia isn't alone. As of August 1st, Philadelphia has had 82 confirmed monkeypox cases per the Philadelphia Department of Public Health. Pennsylvania has had 170. There's been 155 in New Jersey and 5 in Delaware, according to the CDC. A doctor tells us it's important to monitor your symptoms.
Stay home, talk to your healthcare provider. They can probably help guide you on the best way to get tested.
He adds if you've been exposed but don't have symptoms,
So you don't have to quarantine, but contact the Department of Health, especially if you know that the other person has monkeypox, because you might be eligible for vaccine.
the director of the Chester County Health Department says they have enough vaccines for now.
So now over here in this area, pay close attention. They have enough vaccines for now, and they're saying that only certain people are eligible. So now here's my question for everybody in the comment section. What's the eligibility requirement on the monkeypox vaccine?
But we don't know what this is going to look like in terms of how quickly it will spread, and therefore how many close contacts we have.
And that doctor says while the number of cases are increasing across the country and locally, he says testing availability is also increasing.
Well, clearly that's what we need, because it seems like the doctors are having a difficult time diagnosing it manually. Okay. So now here it says monkeypox cases are on the rise across the Delaware Valley and the nation. Larry Jackson, who is that guy that you saw in the video, who's 29 of North Philadelphia, said after multiple doctor visits, he recently found out that he had monkeypox. So again, pay very close attention, because at least on this channel, this is the second instance of where it took someone multiple doctor visits to diagnose monkeypox. Now, here's my question. Do you guys think that that's an issue? If you guys think that not being able to be diagnosed by the first physician that you see for this common problem within a particular community is an issue, put an angry face in the chat. If you guys say, late detection is okay, then go ahead and give me a thumbs up. Okay. It still hurts like some of the bumps hurt, said Jackson. He said it's been painful for days. Jackson is now staying home for 3 weeks, hoping the virus will run its course. But at first, he said he wasn't sure what was making him so sick. Swollen lymph nodes, his throat was swollen, and his body was aching. As of August 1st, Philadelphia has 82 confirmed monkeypox cases, according to the Philadelphia Department of Public Health. There have been 170 confirmed cases in Philadelphia, 155 in in Pennsylvania, 155 in New Jersey, and 5 in Delaware, according to the CDC. A doctor told Action News the number of cases both locally and across the country are increasing. So, I mean, my thing is, if the number of cases locally and across the globe are increasing, it would seem to me that detection methods and availability of vaccines and intervention and telling people how to maintain preventative health should be increasing as well. Now, one thing that I don't see them doing is I don't see them placing a lot of emphasis on education about this. There's not a lot of education going on about monkeypox, which I find fascinating, because educating potential people who could get infected, susceptible populations, that's one of the best ways to prevent the rapid spread of a disease. So I don't know why the government is being neglectful in that way, but I don't think that that is doing anybody any favors. And real quick, ladies and gentlemen, we got 6 live viewers. Shout outs to everybody that's watching, and thank you for watching. And we got 4 likes. If everybody can smash that like button, we'll be at 10. All right. So now here it says, I think that's why most health providers are taking it seriously. We're being proactive about testing people now. That's testing availability has increased really significantly over the past couple weeks, said Eric Schwenwala, medical director for infection prevention, Einstein Healthcare Network. He said it's important to monitor symptoms. Stay home, talk to your healthcare provider. They can probably help guide you on the best way to get tested, said Schwenwala. He added, if you've been exposed but you don't have symptoms, you don't have to quarantine, but contact the Department of Health, especially if you know the other person has monkeypox, because you might be eligible for a vaccine. So now here's my question. What is the vaccine eligibility? Does anybody know the exact eligibility requirements for the monkeypox disease? If you guys know what they are, make sure that you guys put them in the comment section. On Wednesday, 8 more cases were confirmed in Bucks County. Gene Franklin? Oh, there we go. Okay. The director of the Chester County Health Department said they have enough vaccines for now. All right. But we don't know what this is going to look like in terms of how quickly it will spread and how many close contacts we will have, said Franklin. She said anytime the county can order more vaccines, they will. Right now, the vaccine is prioritized for post-exposure. So those close contacts, we'd love enough vaccine to do pre-exposure, which we're just not there, said Franklin. So now I find that interesting because I would think that pre-exposure would be the most important people to give the vaccine to, because if they're post-exposure, they've probably developed some kind of immune response, right? If that makes sense, give me a thumbs up. If it doesn't make any sense, give me a thumbs down. I don't know. That's I don't know why they're doing that. So now, I don't know if you guys are aware, but unfortunately, 2 more kids have come up positive for monkeypox. Were you guys aware of that? If you guys were aware that there are now 4 child cases of monkeypox here in the United States, give me a thumbs up. If you guys were not aware of that, give me a thumbs down. Now, you guys know my stance on it. Shouts out to Donna. What up with it, Donna? I did not see that, but I'm interested to check it out, though. I don't really do too much on TikTok. You know what I'm saying? I didn't see anybody make any YouTube videos about it, but I'm sure I'll come across it. If you want to send it to me, make sure you hit the description box for my other social media. It's really difficult for me to respond sometimes because I get a lot of stuff coming in, but I will be on the lookout for it and I'll try to check it out because I'm interested in that. But the thing is that that probably did happen because the STD method isn't the only way that you can get monkeypox. There's multiple different ways that you can get it. It's just that people are mainly getting it from that way. What that means is that whoever it was that was handling that money, they nasty. That's what that means. They nasty. And that means that she might be nasty too, because what was she doing with her hands after she took that money? Everybody should know that money is one of the most dirtiest things in the world because it passes so many hands. You know what I'm saying? So I hope she wasn't like holding dollar bills in her mouth or anything like that, because that would explain things. You know what I'm saying? That would explain things. My man Mike says, WTF, children? Yep, children. Now, like I said, and I stand behind this, I think that anytime children come up positive for monkeypox, that there should be a CPS investigation. If you guys agree, give me a thumbs up. If you guys disagree, give me a thumbs down. Most of it is in her face. So my question is, do we know that that's where she got it from, or could she possibly just be saying that? Because like my thing is, what does she do? Does she take the dollars and rub them all over her face? I mean, you know what I'm saying? What happened there? You know? What happened there? So now 2 more children in the U.S. have tested positive for monkeypox. My question is, what does that potentially mean? What does that mean that there's a high likelihood of? There are concerns among health officials about how monkeypox could impact young children. My concern is, how are young children getting it? I don't understand the priorities of these people sometimes. Let's check out this 52-second video.
Monkeypox outbreak. President Biden just named top officials from FEMA and the CDC to serve as the White House coordinators to fight the disease. This comes as California becomes the latest state to declare an emergency. New York State and Illinois all doing the same. There are now more than 5,100 cases in the country, nearly 1,500 here in New York City. The mayor defended his administration's response when asked if he thinks the city dropped the ball.
Oh, no, dropped the ball. We advocated for, we were receiving less than we deserved in vaccines.
Man, I swear they're all alike. They're all alike. When I listen to Eric Adams, I hear Herschel Walker. Drop the ball. Drop the ball. Are you serious? Are you serious? Drop the ball. I'm on Mossy, son. You're such a dumbass up.
For, we were receiving less than we deserved in vaccines. We advocated, we utilized our direct communication with the White House to get more.
Meanwhile, 2 more children in the U.S. have tested positive, bringing the total to 4. President Biden is set to be considering declaring monkeypox a national emergency. The monkeypox.
Now, in my opinion, and I've told you guys this already, monkeypox is going to become the new Democratic grab bag for money. If you guys agree that monkeypox is going to become the new Democratic bag grabbing technique, give me a thumbs up. If you guys disagree, nah, that's not what's going to happen. That ain't going to happen. Give me a thumbs down. Me personally, I think that that's what's going to happen. Especially if it becomes a national emergency. They'll have access to a lot of money. They'll definitely have access to a lot of money. Real quick, ladies and gentlemen, shouts out to all 11 viewers that are watching. We got 8 likes. If everybody can smash that like button and get us to 18 likes, that would be awesome. Okay. At least 4 children in the U.S. have now tested positive for monkeypox, officials have confirmed. Now, I want to know, guys, when you hear that, what does that mean? Uh-oh, my man Keldrick says, lay off my mayor. All right, I'll lay off of him, bro. What's up with it, by the way? Amidst the growing emergence of cases across the country, state officials in Indiana confirmed late last week that 2 children had tested positive for monkeypox. So now this is a problem. At this time, no additional information has been made available due to patient privacy concerns, the Indiana Department of Health wrote in a statement. Now, what I find interesting is that when a lot of people are coming up positive with monkeypox, it seems like one thing that people can't seem to do is stay off of social media about it. For whatever reason, I haven't seen anybody put their children up on social media when it comes to this particular case or any of these particular cases with kids. Now we got to make sure that we maintain HIPAA. You know what I'm saying? So now here it says, like many other states, Indiana has seen an increase in monkeypox over the past month. State Health Commissioner Dr. Chris Bach says in a statement. Federal officials had previously confirmed last month that 2 other children in the U.S. had tested positive for monkeypox. So now here's my question. If more children start coming up positive for monkeypox, do you guys think that the United States government will do any kind of special consideration to see exactly what it is that's causing children to come up positive for monkeypox? Because this is a problem. I've been saying this. Shout out to my man, RG Titan. What up with it, bro? One case was confirmed in a toddler who is a resident of California. And the other was reported in an infant, a non-U.S. resident who was tested traveling through Washington, D.C. Now, these are the D.C. and California are 2 of the high infection rate areas. D.C., if you guys recall, D.C. and California are 2 of the high infection rate areas. So my question is, what does that mean then? It's out of the bag now, right? These 2 cases are unrelated, located in different jurisdictions, and were likely the result of household transmission. What does that mean? The result of household transmission. Okay, that means that the transmission took place inside of somebody's home. But what does that mean? What's the details of that? So let's check this out and see what this video is talking about here. We're gonna have to sit through a commercial.
The global monkeypox outbreak represents a public health emergency of international concern.
Classical symptoms that we associate with the sort of monkeypox infection is a rash.
Rash was all over my body, but again, like the doctor said, it was a high fever rash. So because my fever was 39 constantly, it was my legs, my arms, my hands, my chest, my throat. It was all like half white, half red rash. And throat, I could see when I look into the mirror to my throat, it was all white. It was just like covered like a very new scars, and it was blocked, and I wasn't able to. It was very painful to spit.
Symptoms that usually involve muscle pains and swollen glands, headaches, and fever.
Going from having a really high fever and all of that directly into having really intense pain was pretty terrible.
Transmission happens when someone is infected and symptomatic and has close skin-to-skin contact with another person. Transmission can also happen from sharing things like towels or clothing.
So there it is right there, sharing towels or clothing. So that woman who's on TikTok, I hope she doesn't think that like she discovered something monumental or there's some kind of conspiracy theory about how she could have got it from the dollar, because I mean, it's literally been a thing since day one. So I'm gonna play that part one more time.
Was pretty terrible.
Transmission happens when someone is infected and symptomatic and has close skin-to-skin contact with another person. Transmission can also happen from sharing things like towels or clothing.
Overwhelming proportion of people who have been infected are men who have sex with men, but it is not exclusive to that demographic group.
And the lesions started on my nose only. I didn't have any lesions until I got into the hospital and started to take some antibiotics and paracetamols. I think that was like a couple of days after that, the lesions appeared on my hands and on my feet and on my legs.
For the most part, these cases run their course without treatment until the lesions dry up, scab over, and then the underlying skin, it appears normal again. So most of the individuals who have been identified in the United States so far have not required any.
Man, this is gonna eventually be spreading like wildfire in the male prisons. And now that they're doing what they're doing, it could actually spread to the female prisons.
I know that people are very alarmed about this, potentially yet another virus emerging. We do not expect there to be widespread occurrence of monkeypox cases. So we do want people to know that the general public are at low risk for this.
All right, so there's that. And you heard that lady, like right towards the end of the video, she said the general public is at low risk for this. The general public is at low risk for this. Yep, the transmission to anybody can be from towels, bed linens, or just, passing things that have some of the virus substance still on them back and forth. The majority of the cases are from men who have sex with men, but they're not the only cases. They're not the only cases. Okay. So real quick, ladies and gentlemen, shouts out to everybody that is watching the video. Definitely appreciate it. We have 10 people watching. Shouts out to everybody that's watching. And we have 8 likes. If everybody can take a moment and smash that like button, that would be great, and get us to 18 likes. All right. If you guys enjoy this content, all right, the channel, it definitely helps out if you all check out Patreon. The link is in the description. The link is also in the chat. All right. So now here it says, although no information is available about the current status of the virus positive children in Indiana, so the children who have tested positive, these new 2 children who've tested positive are in Indiana. Both of the children who have been diagnosed with monkeypox were said to have been in good health. Well, I mean, if they're diagnosed with monkeypox, how are they in good health? Does that make any sense? Yeah, that's true. Hey, Mr. Knickerbocker. They actually mentioned that in my video yesterday. So now here it says, however, there are concerns among health officials about how monkeypox could impact young children. Now, again, my question is, why is the focus on how monkeypox could affect young children? That should be the secondary focus, in my opinion. The primary focus should be, why are children even getting it and how to prevent that from happening? Because it seems to me, if children are getting monkeypox, unless they're living in filthy home conditions, there's some criminal activity going on. You know what I'm saying? There's some criminal degenerate activity going on that probably should not be going on. So that's highly problematic. Highly problematic. So now here it says, over the weekend, the Centers for Disease and Control and Prevention warned in a health alert that there is some preliminary evidence to suggest, all right, so let's check this out. Over the weekend, the Centers for Disease Control and Prevention warned in a health alert that there is some preliminary evidence to suggest children younger than 8-year-old could develop more severe illness if infected with monkeypox. So we might have a few minutes to take a look at that. At this time, the majority of monkeypox cases confirmed domestically and globally in the current outbreak have been detected in gay, bisexual, and other men who have sex with men. Which, my question is, how is this description consistent with the pronouns that they like to use? That's my question. Because remember, I kept asking that in the beginning. I'm still trying to ask that. And that's exactly what we said, Keldrick. Literally word for word what we said. The parties, the European sex parties, are the main problem as far as spreading it. That's the problem. That's literally where it started. That's where most of the travel cases have come from. European sex parties. You know what I'm saying? Yet nobody suggested a travel ban on Europe. Interesting. So now here it says, however, health officials have repeatedly stressed that the virus does not discriminate and anyone exposed to monkeypox can contract the virus, which is one of the reasons why it's so important, guys, to use basic hygienic prevention. Washing your hands. You know what I'm saying? People are most commonly infected. All right, so pay very close attention. People are most commonly affected by close person-to-person contact, including intimate contact. Though it is possible for the disease to spread through respiratory secretions or by touching objects such as fabrics, which we know there's fabric in money, clothing, bedding, and towels, and surfaces that have been used by someone with monkeypox, which means that you shouldn't sit your raw ass on the toilet, which is something that you shouldn't be doing anyway. You shouldn't sit your raw, naked ass on the toilet, in case people didn't know that. You know what I'm saying? The news of additional pediatric monkeypox cases comes amidst growing pressure from officials across the country for the U.S. to declare a public health emergency for the outbreak. Now, here's my question. Do you all feel that the United States should declare a public health emergency for monkeypox? Do you all feel that way? If you guys feel that they should, give me a thumbs up.
Joining us live, UCSF infectious disease specialist, Dr. Peter Chen Hong, and also Will Hutchinson. He's a fitness coach in Brooklyn and currently has a confirmed case of monkeypox. Good morning, gentlemen.
Morning, Reggie. Morning,
Good
Will.
morning. Good morning. Good morning.
So glad you're both here. I'm going to start with you, Will. So first of all, how are you feeling this morning?
I'm feeling okay. Like I've talked about on my Instagram video, on my Instagram, I think a much minor case, although it has been confirmed as monkeypox. I know there are a lot of people that are going through it a lot worse than I do today. I'm on day 9 since the first time I saw symptoms. I feel pretty okay. The sores are very painful though. So luckily they're not in a place that I am on my hands or anything, because I can only imagine.
Right. So what you'll notice as you see Will on camera here is that he doesn't have any of these pox on his face. They're not on his hands or his feet. They are limited to his genital area because Will believes that he got monkeypox through a sexual contact. Will, can you just walk us through some of the trouble you had of getting diagnosed with monkeypox?
So now here we have another case where somebody's having trouble with the diagnosis. So now we see a third problem developing, is that it seems that physicians are not competent in diagnosing people with monkeypox. So that is going to be something that's going to contribute to the spread as well, until physicians develop a common method to diagnose, or until enough experience with this disease is had where an experience curve takes place and it can be more accurately manually diagnosed by doctors. If you guys agree with that, give me a thumbs up. If you guys disagree with that, give me a thumbs down.
Absolutely. So much like you, I have to wake up very early in the morning sometimes. So I woke up very early. I took a shower the night before. I shower a lot because of my job. So I took a shower the night before, nothing was there. I woke up at 5 a.m. to take my shower and noticed that there were 2 lesions in my groin area. I pay very attention to the news. So I kind of suspected that it was maybe monkeypox. I've never personally had an STI, but and I get screened often because I'm on PrEP and all sorts of things. So I went and I got an STI screening, but I asked them to also test for monkeypox literally that morning, canceled everything because I was a little bit scared. So waited 2 days for that. I got the test results back. Everything came back negative, but I noticed, only because I had done my research, that they had performed the wrong test on me. They had not given me an orthopox test, which is the standard test to try to find monkeypox. So if I had not done that research, I would have been out in the world because I didn't really have very many symptoms possibly spreading it. But luckily, I figured out that it was not the right test. So I ended up going to an emergency room here in Lower Manhattan, asked them to possibly do a screening. They put me in the biohazard room. They did what is recommended by the CDC and the Department of Health, which was like full PPE, goggles, gown, gloves, and they took 2 samples, sent that away. That was on Friday, and just yesterday, so that's about 6 days after, I just got my test results confirmed. And by now, I'm very obviously know that it's monkeypox due to the way the lesions are performing.
So Dr. Peter Chen Hong, I think this is a really good example of what we've been hearing across the country, which is people who suspect they may have monkeypox. They go into a physician, and the physician essentially says, oh, you're fine. It's probably not that, and you don't have an STI, so go ahead and go about your life.
So now you guys see that? That's a common theme. This is becoming a more common theme. What we're seeing is that physicians are failing at diagnosing this. They're failing at diagnosing this. Yeah, and also keep a, like Donna's saying, keep a Lysol spray bottle. A big one and a small one. Keep a small one you can keep with you, and a big one that you can keep in your car or something, in your office, or however it is that you work. And also, why don't you guys spray this video with some likes?
What can people do to kind of advocate for themselves?
Well, I think, Reggie, when Will was getting diagnosed, it was in the earlier days, and now we have commercial labs that can do it, reducing the barriers for clinicians to send the testing. Also, people don't know about it, frankly, still in the community, providers, that is. And that's why I'm worried about, not stopping the chain of transmission, because people want to not transmit it, but if they don't know they have it, either because clinicians are not recognizing it, or there's so many barriers to sending a test and people don't know what test to send,
then you can't separate the people who have it from the people who don't have it, and therefore transmission happens. We've seen this story before with COVID in the early days when diagnostic tests were just sparingly used, and therefore there was a lot of transmission in the community.
I want to ask you another thing about Will's case. As we mentioned, his are limited to his groin area. Why is that in his case, but we are seeing other people who are having these monkeypox spread all over their bodies?
It depends on who you find it. So some people may not know they have it. It's in this particular outbreak, it starts off primarily in the groin area. It's mainly from skin to skin contact. As Will said, usually during intimate exposures. But if, say, it's on the butt, you don't notice it. But I think people do notice when it moves. So it's the movement that distinguishes monkeypox from other infections. It could be like a staph infection or herpes or something else. But the movement to the arms, the face, the mouth is really what sets it apart, the palms and the soles. And that's when a lot of people might notice it, even if they missed it the first time.
Will, what question do you have for the doctor this morning?
Yeah, so I've got a few questions. Like I said, I've been doing my research. I've been diving in, which is part of the reason I knew I didn't have the correct test. But I found a lot of gray areas, especially the CDC and the Department of Health messaging. First off, if I have it, does that mean I have immunity, or do I still need to go get a vaccine?
That's a great question. We think that people who get disease like you did, or infection leading to disease, have good immunity and would be protected. We don't know for how long. But we think, given the experience from smallpox.
So now you guys see this doctor just said the same thing that I said. So now I'm confused as to why they're using the vaccines for post-infection. Remember earlier they said that the priority for the people who are eligible for the vaccine are people post-infection. If, to me, people who are post-infection have some level of immunity, so the people who haven't been infected yet are the ones who should be getting the vaccine. Remember I said that? Now do you guys see why I said that?
Is part of the reason I knew I didn't have the correct test. But I found a lot of gray areas, especially with the CDC and the Department of Health messaging. First off, if I have it, does that mean I have immunity, or do I still need to go get a vaccine?
That's a great question. We think that people who get disease like you did, or infection leading to disease, have good immunity and would be protected. We don't know for how long. But we think, given the experience from smallpox, that you'd be having at least a few years protection. We'll probably get more and more information as time goes on, but that's kind of what the thinking is right now.
Do you think that he should still get a vaccine now, even while he has a current outbreak of monkeypox on his body?
Well, the vaccine in monkeypox is very different from the way we think about, say, vaccines and COVID. So in COVID, if you have COVID, the vaccine doesn't really make any difference whatsoever because it helps for the future. The incubation period or monkeypox moves so slowly that if you get the vaccine in monkeypox, it actually can help you with the disease you have right now, but you have to get in the right amount of window period. So within the first 4 days after exposure, it can help you not even get disease. Within the first 1 to 2 weeks after exposure, it can help alleviate or lessen the symptoms that you already have. So that's the secret about the vaccine in monkeypox that's different from COVID.
So someone in Will's case, within that kind of 4 days of suspecting that he had monkeypox, it could help. But what are you supposed to do? Because I don't think we would probably want someone standing in line in the public next to other people waiting for a vaccine.
Well, I think the biggest advocates would be somebody from a sexually STI clinic. For example, in San Francisco, I know San Francisco ecosystem better would be, City Clinic or Magnet or Strep, because they would advocate for you and say, hey, with your situation, let's get you in ASAP. Don't line up. I'll make an appointment and you come in and you'll get it because you fit into criterion for getting the vaccine. The other aspect is, of course, it could help
Shout out to
advise
Val.
you
What up with it?
about other kinds of therapies as well. If it's really, really serious, you may need to come into the hospital and get other.
Real quick, ladies and gentlemen, if you guys have done the survey in the comment section, throw a radiation emoji in the chat. And if you guys haven't done the survey in the chat, please make sure that you guys do that.
Medicines.
Will, what other question do you have for Doctor?
Well, kind of piggybacking on that, speaking of other treatments and other medicines, I know TPOXX, which is kind of like the name that people are giving to the treatment, is being very scarcely prescribed or not being prescribed at all. My case, like I said, is very minor. I haven't had nearly as many issues as some of the anecdotes that I've read and seen videos about online, but how would you, I mean, it was never offered to me, and I know a lot of my friends who possibly have it as well has not been offered to them. How would you suggest someone advocating for themselves or getting someone to advocate for them to get this treatment?
So yeah, that's a great question. So there's a treatment called tecovirimat or TPOXX. It's a pill form or an IV form. The problem with TPOXX is that it's not FDA approved, so it's not easy to get at any drugstore. No one can easily prescribe it. So it has to go through ethics board and informed consent. And what it means is that even though the CDC is distributing it, not every hospital has gone through the process of, the bells and whistles to get the drug into the hospital. But in many major cities, there are hospitals. So the way I think, coming back to Will's question, you can advocate for yourself is if you have serious disease, that is disease that's confluent or big in the rectal area, in the mouth, near the eyes, because it may affect vision, or extensive, or if you're a bad host, like you're immune compromised, pregnant, or a child under 8, those would be the highest priority for treatment because it can get worse. So advocate for just asking to see which hospital in the area might have it. And then maybe they may take a transfer, may allow you to go there and have access to treatment. I know that CDC and the departments of public health are trying to have more places have access to this medicine. But remember, this is still an investigational drug, which means there isn't great human data and no randomized controlled trial. But in case reports and in animal models, it seems to work well. And it was already FDA approved for smallpox, but not for monkeypox.
And before we go, I just want to make it clear that, you're seeing Will, and he looks great, right? But it doesn't necessarily mean that he feels great. He's had chills, he's had a low fever sometimes, and as he said, his monkeypox are painful. But in addition to that, he is now in isolation, essentially in the room that you see, and will be there until these monkeypox leave his body. So this has been a tough experience, Will.
Yeah, and one more question just to follow up with that, because I know there's a giant gray area. It says 2 to 4 weeks, right, about when your lesions would heal and then possibly like fall off. Are you considered good to go after that, after they've fallen off? I know some videos I've seen and anecdotes say that you're not supposed to possibly have sexual intercourse for like 3 months afterwards. Is that true? I haven't really found anything to back that up.
I think the thinking is you're really transmittable or have infection that you can spread from only when you have symptoms. So not before and not after. So when the lesions drop off, I think you're good to go. As increasingly as people get vaccines and they have access to vaccines, and again, that gives you another layer of security that the person you're going to be with wouldn't get infected.
Gotcha.
Dr. Peter Chin-Hong, Will Hutchinson, it's been a pleasure to talk to both of you. Thanks for being so informative and open and honest.
All right, so there's that. All right, so now here it says on Monday, Illinois became the second state in the country to declare monkeypox a public health emergency and thus designating Illinois a disaster area for the virus. Governor J.P. Pritzker announced in a press release. All right, so now remember, they have the person who's in charge now of the monkeypox. They have a monkeypox task force with somebody in charge of it. And remember, that individual that's in charge of it is a former employee of FEMA. So now here it says monkeypox is a rare but potentially serious disease that requires full mobilization of all available public health resources to prevent spread, Pritzker wrote in the statement. That's why I'm declaring a state of emergency to ensure smooth coordination between state agencies and all levels of government, thereby increasing our ability to prevent and treat the disease quickly. The government's declaration will not allow the Illinois Department of Public Health to expand access to resources such as vaccines and testing in the state's effort to combat the virus. We have seen this virus disproportionately impact the LGBTQ community in its initial spread. Here in Illinois, we will ensure our LGBTQ community has the resources they need to stay safe while ensuring members are not stigmatized as they access critical health care, Pritzker said. So now, what do you guys think about that? What do you guys think about that? Last week, New York became the first state to declare a monkeypox disaster emergency, with officials calling New York City the epicenter of the outbreak. So here in the United States, you guys remember, New York City is the, quote, epicenter of the outbreak. That's not something that Mayor Eric Adams should be behind the podium smiling about. That's actually something that he needs to get on getting under control. So now here it says across the country in San Francisco, officials have also implemented a local emergency declaration for monkeypox. Globally, more than 22,000 cases reported globally, including nearly 5,200 reported in the United States, according to the CDC. Monkeypox cases have now been reported in nearly every state in the country, with Montana, Vermont, and Wyoming now the only states that have yet to confirm cases. All right. So, I mean, we literally have watched this thing start out as something that the government claimed had a low likelihood of becoming an issue, to it now being declared an emergency in certain states, in certain cities. That's where we are. What do you guys think about that? What does everybody learn from that? Have we learned anything? So let me just check something, guys, because I think we might actually be done. Let me just, okay, hold on. All right. Yeah, I had 2 articles up here, but it looks like, wait a minute. Yep, they both require, I guess I must be out of my free articles for the Dallas Times, so I can't access the actual article. So, ladies and gentlemen, guess what? That's it. That's the end of the live stream. If you guys are not subscribed to the channel, you already know what to do. Make sure you smash that like button. Make sure you guys hit the bell. All right. Also, if you guys enjoy the channel and want to support it, hit the link that's pinned in the chat section or go to the description box and hit up Patreon. All right. Also, make sure you guys subscribe to the other channels. And like I said, your boy's going to try to be getting some crime casts out of the way later if I can. 2:30 p.m. Eastern time, TD and Rob. All right. So if you guys aren't subscribed over there, make sure you guys take a moment and subscribe. We're 2 subscriptions away from 1,000. Let's get it. All right. Peace.